A target for achieving 40% vaccination rates across the world has been missed in most African countries. The World Health Organization put forward the goal in early 2021, but only 9% of people on the continent have been fully vaccinated against COVID so far. These low rates of vaccination have been of particular concern following the identification of the Omicron variant in South Africa and its rapid global spread in recent weeks. Over 3 billion doses of COVID-19 vaccines have been administered in the world so far. Of these, about 1 billion have gone to rich countries, which have a population of about 14% of the world, while mid and low-income ones have reportedly only received leftovers. COVAX, a global coalition that was set by the World Health Organization and several non-profit organizations to deliver COVID-19 vaccines to developing countries, has so far delivered less than 90 million doses of the 2 billion it was supposed to deliver by the end of 2021. Strive Masiyiwa, the Zimbabwean billionaire founder of Econet Global, blames the failure on deliberate global health inequality. Masiyiwa was asked to help procure vaccines for the African Union, said this was a deliberate global architecture of unfairness. At a summit on vaccine equity last June, he said, "Imagine we live in a village and there is a drought. There's not going to be enough bread, and the richest guys grab the baker and they take control of the production of bread, and we all have to go to those guys and have to ask them for a loaf of bread." This is the architecture that is in place. According to latest figures from the World Health Organization, just 7 countries on the African continent have reached the 40% target. Of the countries on the mainland of Africa, only Morocco, Tunisia, Botswana, and Rwanda have exceeded the target. Countries in the south of the continent are doing considerably better than elsewhere in sub-Saharan Africa. As of 30 December 2021, just under half of the countries on the continent have achieved more than 10% of the population fully vaccinated, a target the World Health Organization has set for the end of September last year, and which was missed by most African nations. Many countries, including some of the continent's largest, have so far vaccinated fewer than 5% of their populations. Nigeria has fully vaccinated 2.1%, Ethiopia 3.5%, Democratic Republic of Congo 0.1%. The only country on the continent not to have begun a vaccination program is Eritrea. The World Health Organization has set a further target of 70% coverage for all countries by June 2022, but this could also be missed across Africa. As things stand, predictions are that Africa may not reach the 70% vaccination coverage target until August 2024. World Health Organization Africa Regional Director Matshidiso Moeti says. World Health Organization data also found that fewer than 15% of COVID-19 cases in African countries are correctly reported. Overall, nearly 60 million people contracted the virus in the continent, though even that number might not be accurate given the small reach of testing in the region. According to official statistics, only about 8.5 million cases of COVID-19 have been identified in African countries, which have a total population of nearly 1.4 billion people, suggesting underreporting of cases. The World Health Organization says Africa needs more than 900 million vaccine doses to fully vaccinate 40% of its population. The biggest problem facing the COVAX scheme, which many African states were relying on, was its dependence on vaccines from the Serum Institute of India, the world's biggest vaccine maker. Wealthier countries have signed deals with manufacturers for prospective vaccines as early as July 2020, and while they were still in development and undergoing trials. They were given priority by manufacturers, making it difficult for the COVAX scheme, the African Union, and individual countries to secure doses. In September last year, a COVAX statement said it was reducing its estimate of the number of doses it expects to receive going into 2022.